Hello and welcome to Ask the Doctor. I'm your host, Mike Berger. We're talking about the issue of painful headaches today. With us, Dr. Robert Bolger and Dr. Renaud Rodrigue from the Southwest Pain Group. Southwest's mission is to care for patients who suffer from chronic and acute pain. The Southwest Pain Group is actively involved in the care of patients who suffer with pain issues. Just call the number that you see on your screen. It's 1-888-572-4411. Or go to their website, www.southwestpaingroup.com. The phone lines are open. We're going to get started with a question in just a moment, but I want to start this segment off by talking a little bit about headaches and about different types of headaches.
Well, I think the first thing that you need to do if you're going to discuss headaches is discuss the fact that whether a headache is a primary or secondary. And basically what that means is if a headache by itself is the problem, it's primary. If it's from something else, it's secondary, like high blood pressure or, God forbid, a brain tumor or some other problem causing a headache. After that, the main headaches are, typical headaches that everybody knows about, tension headaches, migraine headaches, and the other ones are less common.
Okay, I'm going to look forward to this because we're going to talk about, of course, some things that we can do to help those headaches and maybe some new procedures that have come along. Let's get right to our questions, however. Pam is with us from Dallas. Pam, what's your question?
Every time I have my monthly cycle, I get the worst headaches. So is there anything that I can do about that?
Well, interestingly, migraine headaches related to periods, monthly cycle, is one of the most common cause of headaches. In fact, yes, in fact, women tend to have more migraine headaches than men. And of women that have migraine headaches, 50% of those headaches are related to their cycle. So it's going to be important to make sure that you have a complete hormone evaluation from your OB-GYN doctor and make sure there's not something they can do from that end. And then it is a matter of trying to prevent it, and that you can take preventative medications prior to your cycle.
But it could possibly be related to hormones, or is there something else that could be causing a problem?
Hormones are a big trigger for migraines, along with a number of other things, activity, food, etc. But hormones are intimately involved with migraine cause.
Okay, getting through to keep, if you haven't gotten through, rather, keep trying. Linda's with us from Mesquite, and she's on the line. Linda, what's your question?
Yes, I have had migraines all my life, like since I was a teenager, and Percocet seems to be the only thing that helps, but my doctor doesn't want to prescribe it to me anymore, and he actually says it's the reason that I'm getting headaches. I don't understand what he means by that.
You want to take that one?
Yeah, I'll take that one. Mike, what Linda's referring to here is a common scenario we see, which is called rebound. Patients take medications, and when they're burning off or you're breaking them down, metabolizing in your body, there's a rebound phenomenon which actually triggers a headache again. So you're basically chasing your tail constantly. However, even though it's very common, in fact, a very, very common cause of headache and recurrent headache, some patients actually do need medications, and you have to work around that or find a regimen and tailor a regimen such that they don't experience rebound.
So is this kind of like you take the medication causes a headache, you take the medication, and it's a never-ending thing?
Well, it relieves the headache initially.
And then it's burning off.
But then once it starts the headache, the effects of the medication go away, you get the rebound. And that rebound headache is also called medication overuse headache. Is actually the third most common headache we see today. But after tension and migraine, medication rebound headaches are the third most common headache.
You said medication overuse. So just about any medication could cause that problem.
Well, it would have to be related to the migrainous headache.
Okay.
We don't tend to see that much with tension, but really medication overuse can occur, I think, really with tension and migraine. Do you agree?
Yeah, I agree.
Okay, we have our first question from our viewer on the website. Sheila in Lancaster says her mom has always had bad headaches, and now she has them. Can she get tested for migraines?
Interestingly, there is no test for migraine. Believe it or not, it's a diagnosis based on the history and the character of the headache. Tension headaches and migraine headaches are very different in character and nature. And usually it's some simple history. A migraine headaches tend to be one-sided and pounding and pulsatile, whereas tension headaches tend to be kind of like a band around your head and sort of a steady pressure.
Can people who suffer migraines, I would assume that they can feel them coming on and they know exactly what's going to happen?
They can. That's called a prodrome, where they know it's coming and there's symptoms associated with that. Sometimes it's flashing lights or sound, and they know they're coming. The patients start gearing up. They go in a dark room, turn off lights, and try to ride out the storm. But there's things you can do right there too that can to intervene to abort the headache.
What would that be?
There's a lot of different techniques. You have to work them with patients. And some of the more common ones that are ergotamines, drugs called ergotamines that abort headaches or will stop headache and distract, beta blockers. Some people even use pure oxygen inhalation. They breathe an oxygen mask, and that will oxygen through a mask, and that will abort a headache before it really gets started.
Do we actually know what causes migraine headaches? Can we pinpoint it, or is it something that everybody's a little different?
Take that one.
Yeah.
Interestingly, there are two competing theories, but the short answer is no one knows why we have migraines. But there's the theory of a progression of a depolarization, which means the nerves are firing in the brain. Another theory is the vascular theory, and probably it's a combination of both.
Right.
There's an element of depolarization or an uncontrolled movement of electrical pulses, and then a vascular theory, and they both probably have merit.
When we get a headache, is it because the arteries, the veins, the blood vessels have contracted or expanded?
Well, with the classic migrainous headache, with the classic migraine without an aura, and the aura is that prodrome, it's thought that it's a dilation of blood vessels. And in fact,
Get larger. Yeah.
they get larger. In fact, we know this is true because there are medications we give patients that dilate blood vessels. I used to remember when I was an intern, I would give patients morphine, and they get a terrible headache. I think, why are they getting a headache? Well, morphine causes vessels to enlarge. So the classic vascular headache etiology is a dilating or enlarging vessel.
So I would think it would be just the opposite of that.
Right.
No.
Right.
Interesting point. We have a viewer question from our website. Judith in Garland wants to know how you rate a headache on a scale from 1 to 10.
That's a very individual deal.
I would say because every headache I've ever had is a 10.
Right. It's called a visual analog scale, and you tell patients, how do you rate that? It's got the smiley face and the miserable little face, and you put a line between the two. Or you just tell them from 1 to 10, or 0 to 10, 0 being no pain, 10 the worst pain you've had in your life, where would you put this? And it's not really that critical that you get a scale, except there's one exception. If a patient rolls in and says, this is the worst headache I've ever had in my life, that's actually a medical emergency. Headache sufferers like myself with tension headaches, I know that this is a headache. This is something that's not going to kill me. But if you get a headache and you're incapacitated, it's the worst thing you've ever felt in your life, and there's been none other like that, that's actually an emergency. You need to go to the emergency room for that one.
Can you, how would I want to say this? Can you have migraine headaches all the time? Are they a rare occurrence?
Typically, they come in kind of like periods. So you may have them for anywhere from a few hours to up to 70 hours, and then you may have a couple more times a month, and then not have any headaches for weeks, and then have another 3 or 4 in the course of a month. So it's pretty variable. There's also a variant migraine called cluster headache, where they come in just clusters like that. So there's variations in how they will present.
70 hours?
Up to 70 hours.
Even longer sometimes.
Yeah.
I'm glad I don't suffer from migraine headaches, and I certainly feel sorry for people that do. We're going to take a short break, and we'll be right back. Of course, if you have any questions for our doctors, please feel free to call us at 1-888-572-4411, or go to the website, www.southwestpaingroup.com. Don't go away. We'll be right back with more on headaches. Welcome back to Ask the Doctor. I'm your host, Mike Berger, and here to answer your medical questions today on pain management, our friendly doctors, Dr. Robert Bulger and Dr. Renaud Rodrigue from the Southwest Pain Group. Just call the number that you see on your screen. It's 1-888-572-4411, or you can visit the website at www.southwestpaingroup.com. And let's start out this segment with a question. What are the advantages of the Southwest Pain Group's in-office treatment versus receiving treatment in a hospital?
I'd like to field that one if you don't mind, Mike. This is an area that I have a lot of passion for because I had mentioned before that my mother had suffered from intractable migraine headaches until she went through menopause. But what happens to migraine patients, they get these terrible headaches, they go to ER and they put on a back burner because the ER doctors know it's not going to kill them. They bounce in here every once in a while. We're going to give them a little bit of medication, hope they go away eventually because they can't fix it. But we do a lot of things in our office. We use infusion therapies and even the Michael Jackson drug, propofol, to treat headaches. And believe it or not, that headache's amazingly effective for classic migraines. Not all headaches, but migraines. And we give them that drug, maybe a mixture of drugs intravenously, watch them very carefully, and we can usually totally abort the headache. That's a dangerous drug in the wrong hands. We're anesthesiologists as well, and it's very easy to manage in our setting. In the office, we have all the equipment, and we monitor patients very safely. We've been in it for 16 years, had no problems with it whatsoever.
And that kind of leads into our next question. It comes from Larry from White Settlement. And Larry, what is your question for the doctors?
My migraines, I have these real bad migraines, and they get so bad, a lot of times I have to go to the emergency room about every couple of months. But when I do go there, I don't know, they treat me like a drug addict or something, and I don't know, I feel real bad. I don't know, why do they do that?
Well, I will tell you that we understand that. And the dilemma is that there's a conflicting things at work. First of all, the emergency room doctors want to try to solve the acute problem. Unfortunately, there are people that go to the emergency room and you'll tell them they have a headache when in fact they don't. And so emergency room doctors tend to, unfortunately, undertreat the patients who actually need medication because they don't want to appear to be giving too much medication. So it's a real dilemma, and they're very torn on this. There's some very onerous Texas Medical Board rules on medication, and so there's this conflict. How would you phrase it?
It's exactly what you're saying, that the ER doctors don't know if it's legit or not because it's unmeasurable, and there have been people who've abused it, and they don't want to get their reputation out in the street. This is a place to go get medications when you have pain. They'll give you a bunch of meds IV, and that draws in the wrong clientele. But unfortunately, when you're trying to exclude that group of people, which is rare, you hurt the vast majority of people coming in who are really suffering.
Would it be a good idea then, if I suffered from migraine headaches on a regular basis, to get in touch with someone like you, a pain management specialist, and say, you know, I have this problem. What do I call you?
Now, you just touched on something that's important there. The best way to treat a migraine actually is to try to prevent it. Once the migraine is in full force, then it ends up being an emergency room visit or come to our office with infusion. But the truth is, if you can prevent it with preventative medications, preventive actions, avoiding things, trigger it, being aware of, for example, many people don't realize it, but birth control pills, blood pressure medications, your blood pressure pills, there's many things, your cholesterol pills. There's many things people do that they don't realize can trigger a migraine. So in a perfect world, you try to prevent it. It's hard to break them. Right.
But I do tell my patients not to go to ER because they're going to get frustrated. They're not going to be put on the front burner. They're going to be ignored, or not in a malicious way, just because it's not the right place for it to be for that kind of situation.
The worst situation first. That's the way it has to be. That's what an emergency room is for.
That's right.
We have another caller, Eddie from Balk Springs. Eddie, what's your question?
Yeah, I'd like to know, is there a surgical cure for migraine?
Wow, is there?
There really isn't, Eddie, a surgical cure, but there are surgical techniques, and some are controversial, that may be of benefit. For example, there's been some study in repositioning a nerve in the back of the head, the occipital nerve. But really, the most exciting, to me, I think you'd agree, surgical treatment right now for a migraine headache is the Reed procedure. It's a specialized occipital stimulation and supraorbital stimulation with a battery and some stimulator leads, and it's tremendously successful.
Really?
Yes.
Developed by a local doctor here, a pain doctor we've known for many years, Kenneth Reed.
And is there a percentage of satisfaction from the patients?
Well, he's actually published 2 studies and had an original article published in a very prominent journal, and he's studying it right now. We both work with the Reed Migraine Center and do the Reed procedure, and the success rate is literally almost 90%.
That's incredible.
Now, that's on intractable migraines that have failed other things, failed medications.
It's not for all headaches.
Right. It's just for the people that nothing else has helped.
Right.
Fantastic. We have another quick question from Scott in Mesquite. He asks, can allergies or food cause headaches? Good question.
Great
well,
question.
Yes, they can. In fact, many foods are known to certain cheeses, wines with a high tyrosine content, tyramine content, activities. Certain kinds of vigorous sports activities tend to trigger migraines and migraineurs. Also, dehydration, hormones, medications. There's a lot of things. But yes, foods are one of them.
Absolutely.
Okay, I know from personal experience, wine is a problem with me. Can't have much of
Alcohol,
it.
in fact, alcohol in general can trigger migraines.
Right.
Beer and wine.
And wine especially.
Beer and wine especially.
Okay, we're going to take a short break. Don't go away. Exciting stuff here on headaches. And we'll be right back. Here's your phone number, 1-888-572-4411 if you have a question. Or go to our website, please, www.southwestpaingroup.com. We'll be right back. And welcome back to Ask the Doctor. I'm Mike Berger, here to answer your medical questions on pain management today. Dr. Robert Bulger and Dr. Renaud Rodrigue from the Southwest Pain Group. Just call the number that you see on your screen, 1-888-572-4411, or visit the website at www.southwestpaingroup.com. Now, so far, we've talked a lot about pain management, but what questions should a person ask to ensure they're getting the right doctor to treat their pain?
Well, I think you should look at their credentials. You want to make sure, first of all, that the doctor's done a fellowship. Fellowship is a very specialized kind of elite training that anesthesiologists have to go through to achieve board certification. And I think that's very important. Also, the reputation among their fellow physicians, or rather, reputation of the referring doctors and his colleagues.
Excellent. We're going to keep going with the phone calls now. This one is from Art, right here in Fort Worth. Art, what's your question?
Yeah, I wanted to ask, how can I tell if it's a migraine or a sinus headache?
Well, Art, typically a migraine headache almost always starts out unilaterally. And it's pounding and very pulsatile, whereas a sinus headache is a secondary headache, typically related to an infection, congestion. It tends to be more tension-like. It can also start on one side, but it's much less intense, of less duration, and it responds to sinus treatment.
And basically, is that all in the front of your head over your sinuses? Is that where the worst pain is?
Primarily,
Yeah.
mid-face and frontal.
Right.
Yeah. Okay. And Jim from Garland is on the phone with us. He has another question. Jim?
Am I more at risk for having a stroke because I have migraines?
It's an interesting question. You would think there would be an issue with stroke because of the vascular changes that occur with migraines, but in fact the data is not there. You're at no more risk of a stroke if you're a migraine sufferer than if you're not.
Are there any diseases or medical conditions that you would be more susceptible to?
No, there's really not any. The only thing that's interesting about it is you'll find that if you talk to people enough, get a good history, girls especially, if you have girls who are car sick, little girls, when they're car sick as little girls, they're more likely to have migraine headaches as young women and adults. Yes.
And there's a genetic, I mean, there tends to be a familial link. If the mother had migraines and the patient, her sister had migraines, then they tend to have them too.
Right.
Now, what else about migraines? What else can we treat migraines and or any headaches with? Is there something new out there that we're looking at?
Well, probably an exciting thing is just the infusion therapy.
Fusion therapy. We're doing a lot with the IV medications to treat headaches once they're established. Again, we want to prevent them, but when they're in full gear, their patients are incapacitated. Roll in, we get an IV, we start hitting it with medications to abort the headache. One of the big meds I mentioned earlier was propofol, was a drug that got all the attention with Michael Jackson. Great drug if it's handled properly, and it can oftentimes abort a headache. But we typically mix other medications in there as well, even sometimes pain medications or benzodiazepines like Valium, Ativan, Versed, and other medications IV to treat the patient.
And the Reed procedure, of course.
And then the Reed procedure, very new and very interesting.
Thank you, gentlemen. We're going to take another short break, and we'll be right back. So don't go away. The number is 1-888-572-4411, or the website, www.southwestpaingroup.com. We'll be right back. And welcome back to Ask the Doctor. I'm Mike Berger, here to answer your medical questions today on pain. Our good friends Dr. Robert Bulger and Dr. Renaud Rodrigue from the Southwest Pain Group. Just call the number that you see on the screen. It's 1-888-572-4411, or visit the website at www.southwestpaingroup.com. And now, Bill from Dallas is here with a question. Bill?
Yeah, I have a question. Can playing computer games for a long time cause migraines?
And every mother and dad is saying, tell them yes, tell them yes.
That's right. Well, actually, Bill, it could, because it's known that one of the triggers for migraines is a significant amount of tension. and stress. And so I imagine if you're, playing a game where you're killing zombies from a post-apocalyptic time, it could start out as tension.
Have you been playing some of these, Mike?
But I've seen them. I don't play them. I've seen them. My friend told me about them. But you can create a trigger, and that trigger can turn into a migraine. So the answer is yes.
Right.
So basically, a lot of tension can cause some problems here.
Definitely.
Okay, we have one more time for one more question. This is from Jamie in Euless, and he would like to know: can the weather cause a migraine headache? Being an old weatherman?
That's also a yes. Barometric pressure is linked to migraine, and for reasons that are not really clearly understood. That with a host of other things, but all the migraine patients I've interviewed have said that barometric pressure is a trigger.
Now, is it just migraines, or can any headache be triggered by
It's usually the migraines. You don't see that with tension, because tension is something that's tension related. Clusters are random, but occur in clusters, and then as neuropathic nerve injury type headache syndromes, it's the migraines you see that with.
Yeah.
Okay, now we're coming down to the end of the show. We've talked a lot about a lot of really interesting things today. Anything else that you guys want to touch on to just kind of wrap it up? Any dietary things people can do to help with headaches?
Well, there are. If you go on the web, you'll find a host of migraine-type diets. And if you look at those, the emphasis, essentially, it's a modified Mediterranean diet. And they do emphasize minimizing triggers, such as a lot of red wine. Rich foods, animal fats, reducing those. Corn, a lot of corn is thought to be inflammatory. So you're trying to reduce inflammation, because one of the theories, obviously there's a number of theories, is that you want to reduce inflammatory triggers. Right. So a diet that would be less inflammatory, and that would mean less red meat, more fresh vegetables, antioxidants, fruit, berries, that kind of thing.
We have just a few questions left. I'm wondering if Americans have more migraine headaches than the rest of the world or not.
I'm not sure.
Actually, I never saw anything on that, but my hunch would be yes, because of our diet. I think that we have a lot of problems with high
Going
fat.
right back to what he's saying about fatty foods.
And stress.
Absolutely.
And I think stress, too.
Right.
Stress is a huge trigger for not only tension, but migraine.
Right.
Gentlemen, we have to go. Thank you very much for being with us. Doctors Robert Bolger and Dr. Renaud Rodrigue from the Southwest Pain Group. Remember, even though the show is over, your phone calls will still be answered. Call 1-888-572-4411.
This program is sponsored by Southwest Pain Group and features medical questions from viewers. Nothing within the program establishes doctor-patient confidentiality.